Welcome to Washington Policy on the Go, Washington Policy's Center podcast of news, interviews, and policy analysis.
Welcome to Washington Policy on the Go. This is David Bose, Communications Director for Washington Policy Center. Today we're going to talk about the new book, Healthcare Policy Simplified, Understanding a Complex Issue. It's the latest from Dr. Roger Stark, Washington Policy Center's healthcare policy analyst, and he joins us now. Dr. Stark, as always, it's a pleasure to speak with you.
Great. Thanks for having me on, Dave.
Yeah, sure. So tell us, why create the book about healthcare policy simplification? What was the inspiration? What was your drive to get this book released?
Well, there were really two things. I think what we have seen over the last 40 to 50 years in this country is a gradual increase in the amount of government influence over our healthcare delivery system. And yet, every poll that we have done, the American public believes that there should be a very vibrant private part of our healthcare system. And so what I wanted to do was really look at the historic perspective, how we got into this situation, what the existing government programs look like, Medicare, Medicaid, the VA system, and so forth, what other countries are doing, and then what direction that we should actually take in this country to put patients in charge, to increase access and decrease cost of health care. So that was number one. Then my second goal was to make it very readable. This is not for policy analysts or elected officials or people running for office who already understand a lot about healthcare policy. This is for the average person so that they can get a good fundamental feel for what's going on with our healthcare delivery system in the United States.
What were your biggest challenges in that, in terms of trying to make, a lot of people, they think they understand the healthcare system because we're all interacting with it to one degree or another. So, one, where do you think the biggest misunderstandings are? And two, what was your biggest challenge in terms of overcoming a complexity and simplifying it for an audience that's not used to that part of the system?
Well, yeah, those are really good questions. First of all, everyone has had some interaction with healthcare, with our medical system, just like you point out. And yet it is a very small part, a very small fraction of our overall healthcare delivery system that people interact with. And so they come away from that with some misunderstandings and with an incomplete picture of what actually is going on in this country. So the biggest challenge really was to combine all of the different aspects of our healthcare delivery system and then simplify the language so people can really understand how they interact and how all these different parts work together. It was a challenge, and yet my background, my experience is as a practicing cardiac surgeon, and that was a big part of what I did, was explaining a very complex operation to patients and their families. And so it was sort of like I was primed to do this as a healthcare policy analyst, to simplify and yet combine all the various aspects of our healthcare system in a very readable and understandable fashion.
We're talking about the book, Healthcare Policy Simplified. It's the newest release from Dr. Roger Stark. We're going to put a link to the Amazon sales link in the description of this podcast, or you can go to washingtonpolicy.org, look for this book to be featured on the homepage, or go to the Healthcare Policy Center, and you'll see that book and the links there for its availability on Amazon right there off washingtonpolicy.org. Dr. Stark, one of the ways that you set this book up was chapter by chapter, so that people could pick it up, and if there's a question they have about a certain aspect of healthcare policy, they don't have to read the whole book to try to figure it out. They can just go to any specific chapter and get your take on the various key components of our healthcare system. One of those chapters is the history of our healthcare system, how we got to where we are, and what makes us different from other places. In a nutshell, the United States is known to be a free market, free market oriented society. We're all about trying to reduce costs and increase quality via competition. So how did our healthcare system get so convoluted, and why are we so stuck in the idea of third-party payers?
Yeah, that's a really good question. I mean, if we look historically back when the country began, it was pretty much the government's involvement in healthcare really had to do with the military, with the Army. And then as the decades rolled out, the 18th, 19th century, public health became much more important for the government. And then there were a couple of dates that are really important here, Dave. The first date to keep in mind is 1943. In 1943, we were in the middle of World War II, and the federal government placed wage and price controls on all economic activities. The American public understood that. That was part of fighting this world war. Yet there was a real dearth of employees. And so employers could not compete by offering them more additional salary. So the federal government said, no, you can't give them more wages, but you can give them benefits, such as health care benefits. And then the federal government went on to say, you can not only give them these benefits, but you can deduct the cost of those benefits right off of your company, your corporate income tax. So that was the beginning of the employer model that we have in this country, which is actually fairly unique to the United States. Now, World War II ended, the wage and price controls went away, and yet that model of employers providing healthcare benefits has stuck with us now since 1943. And I dare say, if you go to any street corner in Seattle or Chicago, New York, Los Angeles, and you ask 10 people whether employers should pay for health care benefits, I can guarantee you 8, 9, if not 10 of those people would say, yes, absolutely, employers should pay. So that was number one. That's a critical date. The second critical date is 1965. That's when the government really got involved in our health care insurance plans through Medicare and Medicaid. Those programs have now expanded. They're almost unrecognizable compared to where they began in 1965. Medicare, of course, is health care for seniors. It's essentially a single payer system. Medicaid began as a safety net for low-income families with kids. It has now expanded dramatically. 1 out of every 5 people in the United States are now in the Medicaid program. 1 out of every 4 people in the state of Washington are now in the Medicaid program. So both Medicare and Medicaid have exploded since 1965. The third date then to keep in mind is 2010. That's when President Obama signed the Affordable Care Act, also known as Obamacare, into law, further entrenching the government in our healthcare delivery system. So in a nutshell, Dave, that's how we wound up where we are today, with essentially 90% of all people having their health care paid for by a third party, either their employees or the federal or the state government.
One of the thing you're bringing up here is this idea that maybe 8, 9, 10 of the people that you asked randomly on the sidewalk, should employers pay healthcare benefits? They'd say yes. And I think people who are outside of the policy world, who haven't really thought about, some market distortions, automatically they're going to say, well, Dr. Stark, what is wrong with you? Why wouldn't we want, benefits paid for? Why, otherwise we'd be without health care. So, tell us why, from a policy perspective, we should be concerned about a or a government regulatory system that favors employer-paid benefits rather than individuals purchasing their own.
Well, it's a historic perspective almost completely. But let's look at another way from an economic standpoint. I mean, whether you believe that healthcare is a right or not, I think everyone can agree that healthcare is a necessity of life. Now, other necessities of life, such as food and shelter and clothing, those are not paid for by our employers. They assume that they're going to give you a wage, and you're going to use that wage and the money from that to purchase these other necessities of life. And it should be the same thing with healthcare. The same thing holds true with government. We don't expect government to provide food and clothing and shelter, except as a safety net kind of program. And so there's no reason that the government should be involved, especially in a Medicare or Obamacare kind of setting. So it's really economics 101, if you will. At the end of the day, healthcare and healthcare delivery is an economic activity. It is the most personal economic activity that we have. But still, from a financial standpoint, patients should be in charge of their healthcare dollars and should be making their healthcare decisions, not employers, not the federal, not the state government.
Why do you think there is this disconnect? I mean, one of the things you pointed out earlier was that, and I should add, we're talking about the new book from Dr. Roger Stark, available now on Amazon. It's called Healthcare Policy Simplified, Understanding a Complex Issue. You can see the Amazon link in the description of this podcast or on the WashingtonPolicy.org website. But one of the things that you talked about earlier was that most people prefer a vigorous private healthcare system. And yet, when you see polls, there's frequently this idea that healthcare should be available for all, and by that they mean government should pay for healthcare for all, or there's a substantial number of people who prefer or who like a single-payer plan, or there's popularity among various politicians who call for single-payer plans. Why is there this big disconnect between Americans who want a private system and the benefits of it, but they also want, the government to provide it for them? Where does that come from, and how is that cured?
Yeah, that's a good question. I think a lot of that stems from people seeing healthcare as a right, and yet if you take that one step further, they don't really understand what they mean by healthcare as a right. As we talked about necessities of life, like food, shelter, and clothing. Well, if you look at the government's role there in providing food, shelter, and clothing, the role of the government is to provide access and to allow competition in our food delivery system, in our housing system, in our clothing manufacturers and clothing retailers. And it should be the same thing in healthcare. When people say we should have a right to health care, what they really mean is we should have a right to access health care in a timely, cost-effective way. Now, you can look at Canada, which is a single-payer system. Theoretically, everyone in Canada has health insurance, but they do not have timely access to health care and to seeing providers and hospitalizations. And so it's really a matter of being able to obtain health care, not just have insurance, but to obtain health care in a timely fashion. And that's what I think people really mean when they say we have a right to health care.
Now, before this book was released, the COVID crisis occurred, the pandemic, and we have had various closures, and we've had all kinds of healthcare controversies. And I'm wondering, is there anything within the response to the pandemic that you wish you could have included in this book, or is there any chapter you wish you could add in light of what the nation has gone through with the COVID-19 pandemic?
Yeah, I think what we've seen over the last 20, 30, 40 years is really has been a tragedy from a public health standpoint. We have all these entitlements now, and government funding for these entitlements has really taken away the dollars that should have been spent on public health. And yet public health is really, it's a necessity, it's a requirement, it's a priority of government, just like fire service and police service are priorities of government. And so I think the United States, as many countries we were caught out when the pandemic really ramped up in this country because we didn't have the public health resources that we should have had. And And I think that's the one disappointment that I've had in this overall program. The overall treatment of the pandemic. There have been a lot of headlines, a lot of articles written, op-ed pieces and things like that, blaming this person, this government, that government, and so forth. But I think at the end of the day, what we just were not prepared in a fashion that we should have been. Again, lacking the resources for overall general public health.
Do you think there's a similarity there? Because I've heard you speak before, and I know your book also has this chapter in it about our broken mental health care system. And prior to COVID, remember, that there was a huge sense of a breakdown in society because so many public spaces are occupied now by people addicted to drugs or who have mental illness or perhaps both that are occupying public spaces in tent cities and encampments. And there's just this huge opiate crisis that the nation's facing. And you've talked about our broken mental health care system, similar to what you're saying here about our broken public health care system. What do we do to fix the broken mental health system?
Well, again, it needs to be a priority of government. You've touched on that, Dave. The fact that that mental health really covers a number of different policy issues that impact our communities, our jails, for example, our homelessness crisis, even people accessing food and shelter and so forth. And so, again, mental health should become a priority of government, and it would be much more cost effective to deal with this issue of mental problems right up front rather than deal with increasing the number of people we put in jail and trying to establish homeless shelters and things like that. So I think that's where we should have and where we should be focusing our resources here in the future.
One of the more popular slogans about healthcare that I've heard and concerns that I've heard from people on social media and at various forums I've been to over the years is the idea that in other countries, drugs are cheaper. And in the United States, we're paying top dollar for prescription drugs that people could go to Mexico or go outside of the United States and get, at a steep discount. And it's seen as a problem with the U.S. system that is giving too much to pharmaceutical companies. And what we really need is government to institute price controls that would allow these drugs to be obtained for a bargain. I know your book covers this. I know you've got a special chapter on it, but just in a nutshell for this podcast, what would you warn people? What would you say to those who are thinking, hey, this seems like a good idea. This is the approach we should take?
Well, there are a couple of things. First of all, there is absolutely no question that the American public supports the international drug manufacturing industry. We pay much more than these other countries, like you point out, Dave, simply because these other countries make deals with the drug manufacturers. If we made the same deal like the current federal administration has proposed, what we're going to see is decreased research and development of new life-saving and life-prolonging drugs. And this is not what we want. The American public, we're supporting that industry, but it's to our benefit as well. When you talk about going to Mexico to purchase drugs or Canada, the problem there is that you don't know whether you're getting quality drugs or not. A lot of these drugs are going to be generic. They could come from other countries where their quality control is not as good as we have in this country. And so I would caution anyone who thinks going to Mexico or Canada or Great Britain to get drugs is the way to go. So I don't see that as an answer. The real answer is streamlining the drug clinical research process. It depends on what study you look at, but from the time a chemical is discovered until you have a drug that can be given to the public, the average time is about 12 to 15 years. And again, it depends on what study you look at, what drug you're looking at. The cost of that drug development is somewhere between $2.5 to $5 billion. So a lot of that is because of red tape and Food Drug Administration regulations and requirements. If we could streamline that process, we could get drugs into clinical use in a much faster, timelier manner and much cheaper. So I think that is the answer. It's not putting price controls on drug manufacturers.
It seems like the $5 billion, that's the cost to get something to the marketplace. It would be so prohibitive as to eliminate most competition. Just right off the bat, you're really limiting who can, bring something new to the table. And that's to the detriment of us.
For sure. And I mean, it's an extremely expensive process, obviously, time consuming and so forth. If you could streamline that, we could increase competition and we could get these drugs to market much quicker. One of the challenges that we face here, as you point out, healthcare is still at its root, it's still an economic activity. And we have various entitlements that we've been warning about for years that are creating an instability in our economy and in the budget. And, this can be dismissed, I think, because even now we're spending extra trillions in the face of the COVID-19 pandemic. And people have been warning about, we've spent too much. And the response of the spending from COVID-19 among some has been, see, all this stuff was affordable the whole time. We don't really have to worry about this debt. Has any of that changed your mind about, say, the challenges or the economic instability of the entitlements, the healthcare entitlements that we have? And, what about those who say, hey, we've heard these warnings for years, for decades, and nothing's happened. So why are you still worried about it now? Yeah, if we look at the federal budget as the 21st century rolls out, we're going to get to mid-century, and an ever-increasing part of that federal budget is going to be the cost of Medicare, Medicaid, and Obamacare, such that by the time we get to the little later portion of the 21st century, probably as much as 50-60% of the federal budget is going to be caught up in these healthcare plans. So if we're going to keep these plans, if we're going to keep a safety net like Medicaid, if we're going to provide some kind of healthcare plans for seniors, they've got to be reformed. And we spend a fair amount of time in the book discussing how we can reform those so that they'll be there for future generations, how we can bring the cost of those programs way down, and how we can give more control to enrollees in the Medicaid, Obamacare, and Medicare programs. So that's vitally important for us to do. These entitlements are consuming not only the federal budget, but also the state budget. In 1964, Medicaid wasn't even part of a state budget. Now it is the number 1, 2, or 3 most expensive budget items for every state in the union. In Washington state, it's number 2 behind K through 12 education. So not only the federal taxpayers, but state taxpayers, who parenthetically are the same, but state taxpayers are seeing their state taxes go up, and a good portion of that is for the entitlement payments. In your research for this book, your new book, Healthcare Policy Simplified, Understanding a Complex Issue, available now on Amazon. You can get the link in the description to this podcast or at WashingtonPolicy.org. Dr. Stark, when you were doing the research for this book, and I know there's a chapter on innovative free market policy solutions, were there any of the free market approaches to healthcare that stood out to you as kind of a surprise and a take that you hadn't thought of before that might improve our healthcare system? And then also, what's your number one? If you could tell policymakers, this is the one thing that we could do, even if we did nothing else with this complex system, this is the one thing we could do that would start us down the road to better, more affordable, kind of, as President Obama used to say, was going to bend the curve, or we say now about the pandemic, we're going to bend the curve. But we've seen costs still increasing after Obamacare. We still see costs increasing today. So what about those free market approaches to healthcare? What surprised you, and what would be the one thing that you would tell people, this is what we need to do to improve things right now? Well, first of all, any healthcare reform that increases I think is a positive sort of thing. People ask me that all the time. What do you see in the future? And the answer to that is I have no idea. I mean, there are innovators out there who are going to come up with apps for telephones. They're going to come up with watches that can take your pulse, things like that. At-home ultrasounds, perhaps, things of that nature. If we allow the market to work, there are all kinds of innovative people out there who are going to come up with ideas that individual patients can use. What I would say to policymakers, legislators, and so forth, any kind of health reform that gives patients more control of their healthcare decisions and their healthcare dollars, that is positive. That's a free market kind of solution. In other words, reform the insurance industry, allow the insurance industry to provide the kind of insurance products that people want and need. And we spent a fair amount of time in the book talking about insurance and how we got to this point and how health insurance is different than every other kind of insurance and whether it should be different, quite frankly. So the big thing is for a legislator or a policymaker, I think what you have to do is say, okay, at the end of the day, who is paying for this? And if you say the government or the employers, that's the wrong approach. If you say it's the patient is in charge of their dollars, their healthcare dollars, and is making their healthcare decisions with their providers, that fundamentally, just broad strokes, that fundamentally is the answer to healthcare reform.
Okay, final question for you, and this is again about your book, Healthcare Policy Simplified, Understanding a Complex Issue. You know, you said that this is for the common person to understand the complicated healthcare system that we have, to make it really easy for them to kind of flip through chapter by chapter any category of healthcare so they can get a better understanding of the system, even the parts of the system they haven't dealt with. If, you know, and this is going to be tough, I think, because you put a lot of effort and work into making this accessible to all. But let's say you could have everybody see one chapter, but you had to just pick that one chapter. And you could get everybody in the United States to just read the one chapter and take away the key information in it. Which one would you choose?
Oh, that's easy. I would choose the one on free market healthcare reform. And like I said, we spend a fair amount of time on that. So that really provides the answers for what we see, placing patients in control of their own health care, not employers and not the government.
Yeah, it's interesting. I saw an interesting poll of people who, you know, at first they were enthusiastic about the idea of kind of a healthcare for all slogan. Like, let's just do what some other countries do. And I should add that you do have a chapter on comparing the U.S. healthcare system to all other countries, or at least a big chunk of other countries. But I saw this poll that showed people were kind of enthusiastic about this idea of, hey, let's just have the government take over. Let's have this healthcare for all. But then when you followed up explaining that, you know, after you get the free, and I use the term loosely, free healthcare, the way that the costs are controlled is that you'll have a limited access to it, or your loved ones, because younger people tend not to worry much about healthcare. But if they're told your parents and grandparents will have limited access to it, and ultimately government, you know, bureaucrats will have to decide whether or not they're eligible for certain procedures. That's where support for that approach collapsed. It's when people realize that, you know, if it's quote unquote free, it comes with the cost, that in order to control those costs, somebody else is going to decide who gets access. And I think that's really interesting. There's that disconnect, and that's one of the great struggles of people advocating for free markets, is getting people to make those connections.
Yeah, exactly. And you hear time and time again how other countries spend less on healthcare percentage-wise than we do in the United States. And that's absolutely true. But if you set price controls and you limit the budget, then you have a certain amount of dollars that you can spend on healthcare. When you get to the end of those dollars, then you have to do something. And what you do is you ration. And you ration a number of ways. One is with waiting lists. One is by political influence. Age, for example, can be another rationing kind of tool. And so, yeah, the U.S., we spend more percentage-wise of our gross domestic product on healthcare. But again, these other countries really limit access. Now, for example, we looked at this 2019 in Canada, and the average wait from seeing a primary care doctor until being treated by a specialist, the average wait in 2019 was 20 weeks across Canada. Now, that's 5 months. That would not be acceptable in the United States. And so, sure, Canada, everybody has health insurance, but they don't have timely access, which is really the critical thing here.
My guest has been Dr. Roger Stark for Healthcare Policy on the Go, the official podcast of Washington Policy Center. Dr. Stark serves as Washington Policy Center's healthcare policy analyst, and he has a long and distinguished career in healthcare. You can read more about his book at our blog at washingtonpolicy.org, and I'd urge you to get the book and share it with friends because healthcare policy is one of the top and is reliably at one of the top concerns, one of the top issues for the American people. Dr. Stark, thanks so much for making the time today.
Great. Thanks for having me on, Dave.
You bet. We'll have another issue, or another episode, I should say, of Washington Policy on the Go next week. This is David Bowes, Communications Director for Washington Policy Center. Thank you for listening, and we hope you'll check out the website at washingtonpolicy.org.
Thanks for listening to Washington Policy on the Go. If you liked it, tell a friend and share this episode on your social media. Send any questions or comments to us at washingtonpolicy@washingtonpolicy.org.